Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello, I am Dr. Debajyoti, consultant ENT head neck surgeon and head neck oncosurgeon practicing in Kolkata. Now, today's topic is vertigo is a serious condition and understanding when vertigo is harmless and when to seek help. So, is vertigo serious? Actually, most of the types of vertigo are not serious, but some are, and the knowing is the difference, which is matters. Now, in most of the cases, vertigo comes from the inner ear and not from the brain. This is called peripheral vertigo, and the most common causes includes BPPV, that is benign paroxysmal positional vertigo, Meniere's disease, vestibular neuritis. And these conditions can feel intense. They can disrupt daily life, sleep, confidence, even your ability to move around the comfortability. But in this, these are not life-threatening conditions. And among these, the BPPV is the most common cause. And what is BPPV? BPPV happens when tiny crystals in the inner ear moves out of place and send incorrect motion signals to the brain. It feels dramatic, but it is not damaging the brain. And what is Meniere's disease? Meniere's disease can affect hearing over time, which is significant, but again, it is not typically life-threatening. And the vestibular neuritis often improves gradually, although some people may need rehabilitation to fully recover. So, for most people, the honest answer is this is distressing, this is disruptive, but this is usually not dangerous. But when vertigo becomes serious, when it comes from the central nervous system, meaning the brain, the most important cause to consider is stroke, and especially the another cause is brain tumor when vertigo is dangerous. But the key difference is urgency because stroke treatment is a time sensitive and also the cancer treatment also time sensitive. So you don't need to learn complex medical tests like the Keynes exam that is for clinicians. And what are the warning signs for vertigo? There is slurred speech, if in case of double vision, facial dropping, weakness or numbness on the affected side, trouble swallowing, severe, sudden headache, or being unable to stand or walk properly. In case of severe type of vertigo, in case of central nervous system originating vertigo, like brain tumor or stroke. And in this situation, patient must have emergency care. The most relevant conditions in case of brain tumor or cipiangle tumor is the vestibular schwannoma, which is also called acoustic neuroma. It is a benign, slow-growing tumor of the vestibular nerve. It is gradual hearing loss. One side tinnitus, slow onset imbalance is present in this situation. And in this case, severe spinning vertigo is occurs. So, in this real condition, it is not the usual cause of acute vertigo episode. It is continuous process and it is throughout the some months or years. So the goal is not to ignore symptoms or panic about them. It is to get the right diagnosis. A clear diagnosis tells you what is happening, what is not happening, and what treatment is appropriate and what warning signs actually matters. And if someone has been told it is just anxiety without a proper vestibular or neurologic evaluation, it is reasonable to ask for a more specific harassment. And let's close to the three key points. Number one, most vertigo comes from the inner ear and not life threatening. Number two, vertigo becomes urgent when neurological symptoms appear, especially speech changes, vision problems, weakness, severe headaches, or inability to walk. And number three, conditions like vestibular schwannoma or acoustic neuroma are real but rare, benign, and usually slow growing, not emergency causes of vertigo. Namaskar.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.